Hi, this is Dr. Karuna Kumar speaking, consultant hematologist and bone marrow transplant physician. So today I'll be speaking mainly on the dietary aspects of patients with ITP. Is there really a diet plan for ITP patients? So are there certain foods which you should avoid, or including certain foods, is it going to help you by increasing your platelet count? So I'll be addressing all these concerns in this video. So ITP, we all know that it's an immune mediated disease. Our immune system somehow behaves abnormally and attacks our platelets and clears them from the circulation. So why does the immune system behave abnormally in these patients? Is it something to do with your diet or your lifestyle or your habits? So a lot of studies have shown that ITP, there is no relation with your diet or lifestyle or any of your habits. So what controls immune system? So how is it regulated on a day-to-day basis? And why does our immune system protect our body whereas it attacks anything foreign to us? The key to immune system function lies in certain genes of our DNA. So those are the genes which decides the function of immune system. Our immune system is very complex and most of it is determined by the genetic makeup of a person. And because ITP is an immune mediated disease and it is regulated by certain genes of our DNA, so just making changes in our diet or including or excluding certain foods is not going to help you to control ITP disease or going to help you to increase your platelets. So we need to use drugs which going to regulate our immune system or increase the platelet production. So now coming to your topic, is there a diet plan for patients with ITP? Patients of ITP on treatment, they need some dietary advice. So usually when the patient is diagnosed with ITP and when they have a platelet count less than 30,000, we usually start medications, and usually the first line medication are steroids. So you may ask, doctor, why steroids? Why not other medications? So many people believe that steroids are harmful drugs and they have a lot of side effects. So discussing this aspect, so why steroids are preferred in ITP as a first line medication? Steroids have certain peculiar features. These drugs effectively control ITP disease, effectively control our immune system, thereby increasing the platelet count. And also steroids have a faster onset of action when compared to other medications. So these are the two reasons why these steroids are used as first line medications. But steroids are wonderful drugs and very effective drugs if used for a shorter duration and used at a right dosage. So usually steroids are given for at least 4 weeks and then tapered over 2 weeks and then stop. Once these patients are on steroids, few of them can experience certain adverse effects. So their appetite usually goes up. They have a lot of food cravings and they feel like eating food frequently. Their blood sugar levels can shoot. So they can develop, they can put on weight, and they can have this puffiness of face and swelling of feet. And even steroids sometimes can alter the calcium metabolism, and they can reduce the bone density and can cause osteoporosis also. So there are many adverse effects linked with steroids if taken for a longer duration. So whoever are on steroids, they should follow certain dietary restrictions. So we advise them to go on low calorie, low sugar diet. So preferably these patients should avoid sweets and junk foods and fast foods, which have a high calorie and low nutritional value. And these patients should avoid foods, high sugar drinks and fried foods, processed foods, because all these kinds of food usually promotes weight gain, and they additionally increase the blood glucose levels in these patients and can really affect these patients badly. And also we advise these patients to reduce the salt intake. Why? Because the salt always promotes water retention and it can promote weight gain in this patient. So those patients are on steroid, preferably they should go for a foods with low calorie and which is rich in vegetables and rich in fruits, especially fruits which have a low glycemic index. And they should be able to, they should prefer food with whole grains. To satisfy those food cravings, these patients can eat frequently in shorter durations rather than binge eating at a time. Choosing a diet which is high in fiber can really have a can really satisfy your appetite and can reduce eating foods which are high in calorie. Also steroid can cause changes in mood and can also cause sleeplessness. So better to avoid caffeine products while you are on steroids. And one more important instructions, so if you have a habit of alcohol intake, better to avoid alcohol if you have ITP disease. Why? Because alcohol has a property to reduce platelet count and can also reduce the function of platelets, which can precipitate bleeding in certain patients. There are certain food restrictions you should remember when you take these tablets called as thrombopoietin agonists, which are L-Trombopag, which goes by the trade name Trombopag or Revolade. So when you consume these drugs, it's very important to take them in empty stomach. So why? Because if you take these tablets with food or any other beverages like tea, coffee, or if you take with multivitamins or calcium supplements, these all these drugs and food items can inhibit the absorption of drug, and the drug may go just waste. So remember, when you take L-Trombopag drug, you should take it in an empty stomach, and preferably better to avoid food items and coffee, tea and milk products or dairy products and even multivitamin supplements at least for 2 hours around the drug intake. So these are the dietary changes which ITP patients should follow while on certain medications. So eating overall a healthy balanced diet which is rich in vegetables and fruits with low glycemic index, and eating whole grains is definitely going to help you to get rid of the fatigue which the most of the patients have, and also helps you to maintain ideal weight. Hope this video is useful to you all, and thanks for watching. See you. Bye.